good morning, good afternoon, and good evening. Thank you each and every one of you for being here with us today.
Buenas tardes, buenos días. Gracias a todos por su presencia.
For Latinoamericano Brain Health Institute, BrainLat, let me introduce myself. I'm Durán-Aniotz, co-director of the BrainLat Institute. Briefly, BrainLat aims to empower innovative brain health research leaders across Latin America in full integration with leading centers worldwide. BrainLat seeks to transcend disciplinary boundaries, forge groundbreaking investigation, and reduce the regional impact of dementia. BrainLat will be hosted by Universidad Adolfo Ibáñez at the School of Psychology in collaboration with the Faculty of Engineering and Science, the School of Government, and the Business School. BrainLat will bring together leading national and international institutions in brain science, including the UAI community and the local associated institution, the Neuroscience Center, and the Memory and Neuropsychiatry Clinic of the University of Chile. Additionally, this mission benefits from a partnership with the Global Brain Health Institute at the University of California, San Francisco, and Trinity College, Dublin. BrainLat will conduct world-class interdisciplinary and translational research of brain health and dementia with real-world implications. B, train new researchers and emerging leaders, and C, disseminate evidence to broad audiences. BrainLat will provide a systematic investment in consolidating and expanding brain health research, network, and implementation science during the 2021 to 2025 period. The Institute will be research-based but geared to capacity building and implementation science, favoring regional commitment. BrainLat will also develop an educational and training program starting in the first year. Before we get started, I would like to express my sincere appreciation to all of you who generously helped us to create this institution, Universidad Adolfo Ibáñez, Global Brain Health Institute, and the Alzheimer's Association. We couldn't have done it without you. Well, I don't want to take too much of your time, and I need to leave some time for Harald Beyer, President of Universidad Adolfo Ibáñez, to introduce our institute. Please, Harald, we would like to hear you now.
Thank you very much. Good morning for some of you, for others, good afternoon, and for others still, good evening. So this shows you that this is a global project to some sense. So we're in different hour schedules, and we're very happy of having you in this launching of the BrainLat Institute. So I will speak the rest of my talk in Spanish, I think, due to there is the minister there, and I have to be polite in some sense and speak in the home language. So thank you. O sea, muchas gracias a
Thank
todos.
you to all of you for joining us here.
Que este lanzamiento
I believe that this launching for us as universities
historia larga como escuela de negocios, pero somos una universidad solo hace 30 años. Y la escuela de psicología es todavía más joven. Este año está celebrando justamente 20 años. Y por lo tanto, qué mejor regalo que anunciar el lanzamiento del BrainLat. Somos jóvenes, como decía, pero una universidad tremendamente ambiciosa. Y creo que la Escuela de Psicología es un ejemplo de esto. Es conocida por su formación de pregrado, pero también por su formación de posgrado. Sus programas de investigación están creciendo y está, yo diría, a un nivel superior en el país en su investigación, haciéndola una escuela muy vibrante. Su doctorado en neurociencias sociales y cognición ha sido capaz de atraer a jóvenes científicos de gran nivel. Y dado este desarrollo, parecía natural pensar en una expansión de la escuela que pudiese conectar y profundizar su agenda de investigación, pero también su vocación educacional. El campo de la salud cerebral parecía interpretar bien los intereses de la escuela, de su cuerpo académico, y hay que reconocer que el liderazgo del decano y de Agustín Ibáñez para crear este instituto, como también la posibilidad de afiliarse con el Global Brain Health Institute, la inclusión de otros centros chilenos, hacía muy difícil para la universidad negarse a apoyar este maravilloso proyecto. ¿Por qué salud cerebral? Creo que la respuesta no es difícil. Por una parte, está al centro de los intereses de la Escuela de Psicología. Por otra parte, el impacto de cerebros poco sanos para la economía y para la humanidad es tremendamente significativo. Curiosamente, siguen habiendo muchas personas que creen que no se puede hacer nada para prevenir las enfermedades cerebrales. Si uno pregunta, incluso a personas bien informadas, le contestarán que esto es algo que sucede y que no hay nada que hacer y que solamente se pueden aplicar soluciones remediales. Sin embargo, la investigación ha demostrado otra cosa, que no solamente se pueden hacer cosas remediales, sino que también se puede prevenir. Pero hay muchas cosas que todavía no entendemos y se requiere más investigación. Pero también se requiere formar personas que puedan de alguna forma abordar estos desafíos. Ambas cosas quiere hacer el BrainLat acompañado del Global Brain Health Institute y de otros centros chilenos que permiten potenciar toda la labor que aquí se quiere hacer. Además, este problema es particularmente cierto en América Latina. Los distintos datos disponibles muestran de que la demencia y en general las enfermedades cerebrales están aumentando
Brain
rápido.
disease and brain health issues are on the rise in Latin America. And we have also seen that the population is aging quite quickly. And this is in part a result of that. But at the same time, this has not been a priority for research or for training human capital. And of course, for the various governments and public policies. So it is precisely because of that, because of this void, that we at the BrainLat Institute are here. We are here to close this gap, and we could not have done this on our own. So as a result, as a president of the university, I would just like to thank the Alzheimer Association, the Brain Health Institute, and all the other organizations in Chile and abroad who have been part of this project and who have identified interest in this subject area, as well as a great cause of joy, because we do know that our region is very ripe for research and for training individuals who can help us to stop or prevent this pandemic. We know that the costs are in the billions. Not having appropriately trained and prepared human capital will cost us billions. And if we often view education, the education sector, as the only way to train this human capital, but we do lose from sight at times that we need to have continuing education, and therein lies research, training individuals so that we can all rise to this extremely lofty challenge. So as a university, we believe that we are making a significant contribution to a key area, and not just for Chile, but for Latin America across the board. And obviously this falls within the field of interest of our university. Our university, or universities in the end, are foundations which aspire to improve the livelihoods and well-being of all of our fellow citizens by offering interaction between a variety of different schools and institutes and organizations around the globe. I think that Chile and Latin America truly deserve a BrainLat Institute with this degree of networking and potential for growth and possibility to provide us with a foundation and frameworks that will allow us to solve issues that are so critical for Chile and others. And what is very unique about this project is that the faculty is extremely enthusiastic and very passionate and committed to these concepts and truly willing to be the bridges and add their experiences, offer up their knowledge and experiences to the Institute for all of Latin America and Chile. Thank you so much.
Our next speaker is Minister of Science, Technology, Knowledge and Innovation of Chile, Andrés Couve. Please, Andrés, you have the floor.
Thank you very much, Claudia. Quiero saludarlos a todos.
Thank you very much, Claudia. I would like to greet all of you, ladies and gentlemen. It's quite a privilege to be with you here today. Good morning to those of you in certain latitudes. Good afternoon to those of us in Chile, and late afternoon to the rest of you. I have a few brief words in Spanish.
Participants as well. Thank you very much for joining us from different parts of the world. I think it's important that neuroscience, as in every other discipline of science, we do this in a very collaborative and international way. I think globalization in science is fundamental, and I think is an example of how international relationships should be conducted. Very glad to have our international speakers with us today. Quiero felicitar a la
I would like to commend the university, the president, and a team of individuals who have made this initiative possible. I would like to commend you and thank you, congratulate you for this fabulous project and for the content. It is extremely interesting for the country and for the world at large. And in this regard, I would merely like to refer to two brief aspects. The first is that from within the Ministry of Science, for those of you who are not very familiar with this ministry, it's a very young ministry that has been in existence for roughly 1 year, and we have focused a great deal on science, making science, technology, innovation, placing this at the service of people. And we have focused a great deal on specific local actions and our comparative advantage and competitive advantage at the same time, because these two aspects are key for international, our ties with international institutes and domestic capacity as well. For example, our oceans and the Antarctic, and we have a privilege in this regard. And then we have the northern deserts and climate change in Patagonia. And obviously we have a significant comparative advantage in this regard. And then given that as the backdrop, all of a sudden we discovered that we had this project fall into our laps. And we said, okay, well, neuroscience, do we consider this to be competitive and comparative advantage? Well, when we started delving into the finer points, we obviously realized that it was essential to encourage and foster research in all the various disciplines. But at the same time, we had to acknowledge that we are a natural laboratory and we are curious, of course, and we have this historic situation in Chile that is not necessarily the result of our curiosity, but rather they are the result of a natural development, historical development, and that's the way it is. And today we have become experts in these realms and these disciplines, and neuroscience is one of these. And historically speaking, this discipline has been developed quite significantly in Chile. For example, neurophysiology is something that has been closely studied in Puente Mar, in the laboratory there. And when you begin to look back, you will see that we are closely tied to a discipline to the emergence of this discipline. This is something that has occurred historically in Chile, thanks to the interest of Chileans in this field and their passion. So first of all, I would like to congratulate you for using this tradition as your bouncing off point. As I mentioned, this is part of our background, of our history, not because of any competitive advantage, but because creative, hardworking individuals decades ago were present at the founding moments of this discipline. Now, it's also important to bear in mind that this initiative tries to link brain science with applications, practical applications, so that brain science will actually contribute to individuals' health, to contribute to alleviating some of the diseases that have been mentioned here, but also making a contribution to other areas of health. And I would like to point out the importance of this science, but in an applied manner, as an applied science that actually brings about solutions for health. So this is key. I'm sure that this will aid us in solving problems, but will also allow us to grow the quality, wealth of knowledge out there. So science, essentially placed at the service of individuals, is essential. And also when it's based on multidisciplinary partnerships, that is key as well. It's likely that we will see a variety of different partnerships formed with hospitals and university, hospital, research centers, and others. And it's quite interesting to see that this is brain science, and we need to draw a line and mark the difference between brain science to mental health, or it's, for example, how you move from electricity to memory to awareness. And it would seem as though the name of this center, BrainLat Institute, I would say brings to mind the gray matter aspect, the place where all the connections are actually occurring. And we know that there are aspects related more to the mind, not so much to the brain. And it would seem as though through this endeavor, we are boosting our experimental experience. And I think the link between brain and mind is an advantage that we need to leverage, an advantage of our times. Now, our ministry is very much interested in mental health. We are also trying to make a contribution there. For example, there was an event with regard to the need to take care of our mental health during the pandemic. And we talked about how we can allow mental health information and knowledge permeate society and reach the people. So it's important to foster more research there and ensure that this knowledge can actually trickle down to individuals and be used to their benefit. Also, we held a project in which we funded several different mental health projects related to COVID-19, and this also within the Adolfo Ibáñez University. So we are not just committed to fostering research, but disseminating knowledge. And I believe we can expect this institute to take part in this network of centers of excellence. We have these millennial centers and the baseline centers, and there will be other centers opening up in the future. And we believe that these are the seed capital, if you will, for other larger endeavors that we are all prepared to take on. So it's a privilege once again to share this with you, and I am pleased to have been invited, and I wish you the best of success in an extremely competitive discipline. We know that, but at the same time, we also know that this discipline is one of the areas today in which progress and advancement have been so insurmountable. And we believe that for many years to come, we will be able to enjoy the tools we have now, tools we didn't have in the past. So to answer so many crucial questions. So thank you so much. Unfortunately, President Beyer, I need to bid you farewell. I have a very tight agenda. So thank you very much. The best of luck and nice to be here. Thank you for joining us, Minister.
Thank you very much, Andrés, for your work. Now, it is my pleasure to share with you a couple of words from María Carrillo, Chief Science Officer of the Alzheimer's Association. Give me 1 second. I'm going to share.
It's a pleasure to be here with all of you, even virtually. On behalf of the Alzheimer's Association and individuals around the world and their families affected by Alzheimer's and dementia, thank you for all you do to advance research, to understand this disease and ultimately prevent or effectively treat it. Congratulations to Dr. Ibáñez and Dr. Durán-Aniotz on today's exciting celebration. It's a great accomplishment to establish this new center of excellence, the Latin American Brain Health Institute. And congratulations to the leadership at the University Adolfo Ibáñez in Santiago, Chile, for the exciting launch of the BrainLat Institute, with the goal to empower a new generation of leaders and forge innovative approaches to advance and accelerate research. It's both professionally and personally exciting to see this continued growth and expansion of opportunities across Latin America. In 2015, the Alzheimer's Association convened our first Alzheimer's Association Satellite Symposium in Mexico City. And I committed to all of you that it would not be our last. Since then, we've had several others, including in Latin America. And I feel that we at the Alzheimer's Association have contributed a little bit to the expansion of Latin America, and of course, an expansion of the links that Latin America has with the rest of the world. As a global partner in Alzheimer's disease and dementia research, we also recognize the need to create more opportunities for us to convene together and to bring all of us together as an international research community at meetings like this one. BrainLat shares this vision and the goal of connecting that global community, aiming to develop and support full integration with leading centers worldwide. Alzheimer's disease and other dementias are a global challenge. And by being here today, all of you, all of us are a part of the global conversation and the potential solution as well. The Alzheimer's Association is also very proud to have the Global Brain Health Institute as one of our key partners. Through both convening and funding, we've worked together for a number of years, and we look forward to continuing our work with GBHI and, of course, adding now BrainLat. There are no boundaries of who or where individuals are affected by Alzheimer's. And the next breakthrough, prevention and detection and treatment may come from anywhere in the world as well. And as the world's largest nonprofit funder of Alzheimer's and dementia science, with over 300 million active and committed dollars to 650 plus projects in 39 countries, we are pleased to see more and more funding going to Latin America. 12 countries in particular across Latin America that of course include Chile. And to share a bit more about our commitment to funding, including our funding in Latin America, I invite Dr. Heather Snyder from my team to share a few highlights.
Thank you, Maria. And now it's my pleasure to present Heather Snyder, the Vice President, Medical and Scientific Relation at the Alzheimer's Association. Second.
Thank you, Dr. Carrillo. And I add my congratulations to the entire team on the launch of BrainLat. This vision is to be celebrated, and we look forward to continuing to work with you. And we look forward to sharing opportunities about the association's funding programs with the investigators and research teams of BrainLat for future applications. There is currently today a little over $2.2 million of the Alzheimer's Association's active and committed at work in Latin America. And this includes 7 active projects in Chile. Many of these projects are being driven by individual efforts of investigators, but a few are tied to larger strategic opportunities, leveraging that collaborative spirit. One of these, LATAM Fingers, spans 12 countries and is funded by the Alzheimer's Association. This team will evaluate multimodal behavioral interventions in different settings, evaluating the impact of these interventions on cognition. And I know many of the leadership of this important study are gathered with you today. LATAM Fingers is not only working across Latin America, but is also aligning with other multi-domain interventions such as US Pointer, AUARO, and others throughout the worldwide Fingers network. Similarly, the association's partnership with BrainLat is further strengthened by our commitment to the REDLAT project, along with GBHI and the Tau Consortium. And I know you'll be hearing more about this important work today. REDLAT represents multiple partners, all working together to expand dementia research across and within Latin America. These synergies and connections speak to the same goals as BrainLat, building and linking the infrastructure for exciting and accelerated research to address Alzheimer's and all dementia. We look forward to continuing and growing our work together to achieve these goals, breakthroughs in prevention, early detection, and treatment for Alzheimer's, all other dementia, and brain diseases. We wish you the best event today, and we look forward to working with you in the future.
Thank you so much, Heather. And now it's my pleasure to present our next speaker, Executive Rector of the Global Brain Health Institute at the University of California, San Francisco, Victor Valcour. Please, Victor, we are ready to hear you.
Can you hear me now? Yes, technology. Felicitaciones a ustedes por el nuevo Instituto para la Salud del
Congratulations then for this new institute. In the institute, we are so happy to be able to work with you.
I'm a professor at the Memory and Aging Center at the University of California in San Francisco in the United States. Here I work closely with Dr. Bruce Miller, who would like to share his personal congratulations on the launch of BrainLat. A major part of my job is to work with colleagues across the world, and particularly in Dublin, Ireland, to implement the Global Brain Health Institute. Established in 2015, the Global Brain Health Institute has trained more than 140 Atlantic Fellows for Equity in Brain Health from over 40 countries at our 2 founding institutions in the University of California, San Francisco, and in Dublin, Ireland. We're fortunate to have strong partners in this global effort, including the US Alzheimer's Association that funds nearly 2/3 of our early seed pilot studies to allow our Atlantic Fellows to achieve change in their home communities. Many fellows have leveraged these pilots for larger funded initiatives, including substantial cross-country dementia consortium work, such as the REDLAT Consortium that is led by Dr. Agustin Ibáñez. We at the Global Brain Health Institute intentionally initiated our work in Latin American regions, and this emphasis has really paid off over the past 5 years. We're now seeing a growing cohort of clinicians, neuroscientists, journalists, photographers, and more who are joining us in our efforts to protect the world's aging populations from threats to brain health. The Atlantic Fellows for Equity in Brain Health program intentionally focuses on the inequities in brain health, with particular emphasis on vulnerable populations. The determinants of a healthy brain are rooted in the social determinants of health and inherent disparities. Many of these social determinants are modifiable and driven by the same disparities that drive other illness, factors such as poverty, access to care, access to a healthy diet, and the fundamental right to an education. Moreover, the global cost of dementia will reach $2 trillion by 2030, and this will particularly affect low and middle income countries where dementia prevalence is growing the fastest. Much of these costs are informal costs, with families, often women, interrupting their careers to provide care. This adds to the inequities, and particularly the gender-based inequities that already exist in many regions of the world. And finally, for those with dementia, the inequity is augmented by the stigma of living with mental illness, in addition to often societal stigma of being old. On a personal note, it's been a highlight of my career to see the Atlantic Fellows achieve such meaningful change in Latin American communities. Some of you may remember my very limited Spanish last January, where the only phrase I could get out was, "La manzana es roja por fuera." But learning Spanish is an indication of my personal commitment to our work in Latin America. Launching BrainLat links to my personal philosophy that our core purpose is to accompany and champion our Atlantic Fellows as they seek culturally and regionally appropriate change in their home communities. Our model is novel. We bring people from around the world together from every discipline. Our role is simply to provide the space for learning and to champion the network to achieve change around the world. As a prominent example of this philosophy, Dr. Miller and I worked with Dr. Ibáñez and other faculty at UCSF to establish the first funding stream for this massive effort to characterize dementia across Latin America. I'm delighted that in the past year, more faculty have joined us to extend and fortify this Latin American cohort study termed BrainLat. We will extend it into understanding traumatic brain injury in Latin America, the social determinants of health, and novel work looking at automated speech analysis to detect dementia across the REDLAT consortium. BrainLat is crucial to these efforts, with both REDLAT consortium and Dr. Ibáñez's other work linked tightly to this new institute. We're particularly grateful that BrainLat represents a public-private partnership, which resonates tightly with the equity lens at the Global Brain Health Institute. Together with others, we are committed to the success of BrainLat and will work with all Atlantic Fellows for Equity in Brain Health to achieve our mutual goals. As such, today marks a major milestone in our shared journey to protect Latin America's aging population from threats to brain health. Felicitaciones otra vez. Estamos felices de trabajar.
Congratulations once again. We're so happy to work with you. Thank you.
Thank you very much for your work, Victor. Our next speaker is co-director of the Global Brain Health Institute in Ireland, Ian Robertson. Please, Ian, we are ready to hear you.
Well, thank you very much. It's a great honor to be invited to attend this launch and to be on the board in LAT. To follow up my dear colleague Victor Valcour's excellent introduction to the Global Brain Health Institute, we are the world's only leadership training program for early to mid-career professionals, including scientists, medics, journalists, lawyers, architects, towards building brain health as a value, particularly, as Victor says, for people and peoples whose brain health suffers because of inequity, because there is this double whammy of brain health. It is both a source of inequity if your brain health is poor, for instance, if you're developing various types of dementia, but it's also a cause. Inequity is also a cause of brain health. So this is double whammy, I think that was a phrase that Victor came up with. So I'd like to say that the reason I feel so particularly privileged to be part of this fantastic initiative, and I have to pay tribute to the co-directors, Agustin Ibáñez and Claudia Durán-Aniotz, and to the president of the Universidad Ibáñez for this really visionary move. I feel so privileged because I think we've seen with the COVID pandemic, we've seen how critical things are for the human species in terms of the various global challenges facing them. We've seen the pandemic, but there's also climate change, and there's also brain health and the onset of dementia, which, as we've heard, will particularly affect certain parts of the world, including Latin America. So Global Brain Health Institute, it fosters excellent leaders like Agustin and Claudia. We're very proud of Agustin as one of our senior fellows, one of the network of fellows we have trained in the Global Brain Health Institute. And to see a partner institution developing in Latin America, where we can extend our training, but also learn from you, extend our knowledge through interactions with a fantastic center like you have here, because science is a noble and moral endeavor, because science is a method that corrects the inevitable tendency of the human brain, the human mind, to try and find evidence to support its preconceptions. Science is a brilliant invention to try and counteract that heuristic that has caused so much trouble in the world when people become overinvested in ideas or ideologies and they impose them in the world, sometimes with terrible consequences. So I am proud to be part of a science-led, science-informed international network of fantastic individuals. And I'm so looking forward to developing even stronger links with Chile, with University Ibáñez, to strengthen our links with our dear colleagues in UCSF in San Francisco and other centers as we develop them through the world. So I just say thank you so much for this incredible initiative, and thank you for including me in it. And I'm just so much looking forward to doing that. And I say this on behalf of all my colleagues here in Dublin in the Global Brain Health Institute, including my dear colleague, Brian Lawler. Thank you very much indeed.
Thank you very much, Ian, for your words. Now it's my pleasure to present our director of BrainLat, Agustin Ibáñez. Please, Agustin, we would like to hear you now. You're mute.
Here we go. Sorry. Thank you so much, Claudia. Can you see my screen now, right?
Yes.
It's a great pleasure for me. This is a very special day. It's a day of a long-awaited dream. I have the pleasure to present this network, this really crowd working of so many people, the Latin American Brain Health Institute. So I think that since, I don't know, 10 years ago, I realized how important it is to have a central hub in Latin America for brain health. As many of our colleagues have shown, we are facing big challenge, including large inequalities, fragile health systems, more than 50% of the population with informal job, and more of 55% of the patients with dementia being influenced by modifiable factors like poverty, education, and many others that Victor and others have mentioned today. So we really need a regional hub. The GBHI has making an incredible job, but I think that we need local centers connecting with the GBHI in order to face specific local barriers and develop a truly active network to face our challenge. So I think that truly regional coordination is one of the values of BrainLat, and BrainLat is aimed to empower leaders and innovative research in Latin America. we want to make research, but we want that this research make changes, especially regarding capacity building for local teams and implementation science. We want to work in multidisciplinary innovation. We don't want to focus just in the brain. We want to combine genetics with neuroscience, with cognition, but also with policymakers and brain health diplomacy to create a multimodal perspective on brain health. We want to empower local ideas, but not in an isolated way, but just in a global landscape. I think that our population is a very diverse one and very underrepresented, and we need to change that reality. And we want to transform this challenge into opportunities. If we work together, if we coordinate efforts, surely we will be able to make really, really large changes. The Institute is mainly led by the School of Psychology under the direction of Jorge Sangüesa and the co-direction of Claudia Durán. But we are also aimed to be associated with the Faculty of Engineering and Science and other faculties as the Business School and the Government School. Our institute will be associated with two public institutions, the HERO, the FONDA research projects aimed to develop the largest aging study across Latin America, and the Clínica de Memoria y Neuropsiquiatría, led by Andrés Lacheski, another board member of our executive committee. And we want to do following this multidisciplinary approach that we have learned from the GBHI, combining different disciplines, populations, and perspectives. You already have here huge histories about the GBHI. I just want to say that I was an Atlantic Fellow. I completely changed my life, and I think that is the best place to make really, really big changes. I just want to say thank you, Bruce Miller. He was the first one. He pushes me and this idea to develop a regional hub. But then Victor Valcour has helped me so much to develop a truly systematic, organized, equilibrated approach to the BrainLat together with the GBHI. And more recently, I have the honor to begin to work with Jan Robertson and Brian Lawler from TCD, where we expect to develop a very active agenda combining networking, research, grant applications, and capacity building in the following years. So our team at this year is a small one. We have an executive committee that will have the voices of all the faculties, the director, the co-director, but also the GBHI and the others, school of the university, and also from our associated centers, public centers. This will allow us to have a very democratic and horizontal decision-making process. This year we have 3 lead investigators: Graciela Muniz from Edinburgh University, who is a well-renowned researcher in prevention; Pavel Prado, who is a neuroscientist working in affordable biomarkers like EEG; and Enzo Tagliasucci, who is an extremely prolific researcher working in computational neuroscience. But also we already have many postdoc, PhD staff, and affiliated members who are already working to make this institute an active hub. In the next year, we will complete more than 14 faculty positions, and we hope to develop strong opportunities for other researchers. BrainLat will also support the LACCD, the Latin American and Caribbean Consortium of Dementia. This is a network integrated by the leaders of dementia across Latin America and with the support of the GBHI and the Alzheimer Association. I think that this is a huge opportunity for the LACCD to have a really local hub supporting the networking activity that we are developing. But BrainLat, as Heather mentioned, will support also RedLat, the multi-partner consortium to expand dementia research in Latin America. In this approach, we want to understand the interaction between social determinant of health and socioeconomic factors together with genetic influences, and how these two factors makes the Latin American population unique in regards to US populations, assessing different patients with dementia and healthy controls. We will combine genetics, neuroscience, cognition, behavior, and state-of-the-art multimodal machine learning approaches with the support of several stakeholders across the different centers. But BrainLat already have begun to develop their own research, combining funding from ANID, the National Research Council of Chile, or other international fundings. And we have the pleasure to introduce the BrainLat seed grants. Those are small grants for people working for Latin America with the aims to develop larger projects and initiatives for a second application. We already have 6 seed grants, but we will continuously call this year for additional seed grants. From the GBHI, we hope to learn through our affiliation the mission that they have been developed, that is a unique vision, helping to combine actions with research, impact with policymakers. We will work to have an educational and training program from faculties and for future fellows in Chile also. We will develop mobility and faculty interaction. And since this year, we already have begun to apply to large grants involving Chile and Latin America through conjoint applications. From the Universidad Adolfo Ibáñez, we will have a specific faculty devoted exclusively to BrainLat. That is really a privilege in the current pandemic times. We will develop local associations within the university across faculties and schools, but also with external institutes. We will bring the infrastructure, a core center for all the sub-departments of BrainLat. The counselor is providing a strong investment of several $1 million to support this project. And we will have 2 PhD programs. One is already running, and the second one will be focused in brain health. It will be the first one in the region, I guess. And we also will have the access to neuroscience techniques like TMS, EEG, MRI, wet labs, and others. So we are now on the stage 1. We are working to develop a plan for the forthcoming years, to making the formal internal and external agreements, to have the initial faculty and developing the calls for more faculty and postdocs, beginning to run the first seed grants, and developing an international advisory board that will be a source of networking and collaboration. In the second stage, we will complete our faculty. We will begin to have a training and interaction with the GBHI in a systematic way. And we will begin to apply to educational grants to support the work for future fellows and also research application. The last stage will be focused in launching a fellows program inspired by the Atlantic Fellows Program of the GBHI and in affiliation with the GBHI that I hope will be transformative for Chile and the region. We will begin the PhD program and we hope to develop large regional projects. So this institute has been possible thanks to so many people being involved in direct and indirect ways, but I just want to say a special thanks to Claudia Durán-Aniotz, the co-director of the Institute. We have been working side by side to have this institute in the middle of a terrible pandemic situation. I also want to say thanks to Andrea, who is the program manager and joined us in a few months ago, and she has been working so many issues. I have to say a special thanks to Jorge Sangüesa. He was not talking today, but he should. He has been designing this idea and working very intensively from the beginning, and without him, no BrainLat will be possible. And finally, the counselor, Dr. Harald Beyer, for having the vision to see how important is BrainLat for the future, to invest and to trust in our teams and to move forward towards internal and international integration of our institute. Please have a look at the website. You can be in touch regarding any information regarding new positions, postdoc, seed grants, and networking. And thank you all for joining us today in the lunch. I hope that you can be part in the part of the BrainLat in the near future. Thank you so much.
Thank you very much, Agustin, for this amazing presentation of our institute. Actually, we have a couple of minutes, and I would like to present our Dean and Executive Director, Jorge Sangüesa. Please, Jorge.
Thank you very much. I need to speak in Spanish. Agustin decía que
Agustin was saying that I wasn't going to speak today, and that was how it was planned, but I feel that
acompañan hoy, porque el paso que estamos dando es un paso muy significativo para la historia de la escuela y la universidad, y esto no hubiese sido posible sin la convicción de quien lidera este proyecto, Agustín Ibáñez. Hace 6 años justo comenzamos algunas conversaciones que permitió que Agustín, junto a David Huepe, a Josefina Escobar, Gorka Navarrete y otros, pudieran acercarse a la Escuela de Psicología de la Universidad Adolfo Ibáñez. Y hoy día, 6 años después, en un contexto diferente, estamos concretando esta nueva iniciativa que busca impulsar definitivamente el aporte que la psicología puede hacer en este campo. La incorporación de Claudia Durán el año pasado y hoy día el doctor Pavel Prado y Enzo Tagliasucci vienen de alguna manera, ¿cierto?, a consagrar que la psicología no solamente debe ser abordada y los desafíos de esta desde la disciplina particular, sino de la interdisciplina, de la transdisciplina. Y esto es justamente BrainLat. Por eso es que hemos acercado, y quiero agradecer también aquí la presencia de mis colegas decanos y decanas de las otras facultades y escuelas de la Universidad Adolfo Ibáñez, y por cierto, al rector y al equipo de rectoría que con aprehensión siempre y con mucha presencia fue capaz de creer en un proyecto que busca potenciar las alianzas por sobre la capacidad de estar estudiando a nivel pequeño, circunscrito, ¿cierto?, el fenómeno que tenemos por delante. Solo agradecer, estamos moviendo el cerco, el límite de la disciplina, y eso nos tiene tremendamente orgullosos porque pensamos que de esa manera podemos aportar desde la psicología de la UAI a un Chile que tiene necesariamente que construir mayor capacidad de generación de conocimiento aquí y en Latinoamérica. Quiero también agradecer a Víctor Valcour, Jan Robertson y al equipo de GBH que nos ha dado una mano. Este viaje que partió en San Francisco hace poco más de un año con una firma de un letter of intent nos permite hoy día estar haciendo este lanzamiento. Estoy cierto que la cooperación entre estas distintas instituciones para nosotros es un aliciente para que podamos generar más y mejor de nuestro trabajo. Muchísimas gracias.
Thank you very much, Jorge. So, ladies and gentlemen, we have reached the end of
Damas y caballeros, hemos llegado al final de este lanzamiento de nuestro instituto, y antes de despedir
those wonderful and inspiring words, I would like also to thank all of you for being here with us today. As the BrainLat Institute, and as Agustin mentioned earlier, we seek to be a flagship Latin American center for brain health research, prevention, and promotion in collaboration with an international network of excellence. We look forward to see you again in all of our seminars, activities, and webinars. Thank you very much. Muchas gracias.